PEMF is pulse electrified magnetic field. It's a science and technology that's been out there for over 50 years, heavily researched in different categories. And one of the things that we look at for the PEMF is how can we utilize that in an office or a practice setting for folks that are looking for something that's non-invasive. And there's a broad stroke of how it relates to the cellular level and the actual signaling that happens between those cells to really have an impact across different avenues or channels, if you will, from inflammation, chronic pain, circulation, and then also recovery. In some cases, in some states, it shows some regeneration at some levels.
That's awesome. So what? As we get into that, what does that overall experience look like? As somebody comes into the office, what are some of the first steps that the patient can expect when they're getting the PEMF treatment?
Yeah, for treatment, the great thing about that, because it's not invasive, it's very easy to receive the treatment, but also easy for the staff in the office to implement when they're working with their patients, because it can be done in a very relaxed setting. So depending on if you're using an individual attachment for a specific joint or pain specific area, or if you're doing more of a systemic where you're in a more relaxed state, there's a mattress that will provide the PEMF treatment where you're getting a lower level frequency and intensity, but again, very acute to what we're trying to accomplish. So it's a very easy thing to implement within the office because you can do it in any room in your office. You can do it in an open setting in your office as well, depending on how your office is set up.